Hello and good afternoon, everyone. I hope everyone is doing well. Thank you for joining us this afternoon. I'm Jennifer Lopez, the CEO of the British Malaysian Chamber of Commerce. Welcome to the BMCC in Conversation series with our special guest today, Dato Dr. Anas Alam Faizli, the Chief Executive Officer of ProtectHealth Corporations. Our session today will be moderated by Mr. David Ng, the Managing Director of International SOS Malaysia and Myanmar. Welcome, Dato Dr. Anas and David. Good to see you both. Ladies and gentlemen, the theme for our conversation today is on National COVID-19 Immunisation Programme, PIC. I'm sure everyone is familiar with this term PIC, critical contributions of public-private partnerships. As we are all aware, the National COVID-19 Immunisation Programme, PIC, is a massive nationwide effort by the Malaysian government to immunise the Malaysian population against COVID-19. I'm sure we all agree, despite all the challenges along the way, the rollout and progress of PIC is highly commendable and successful today. With what I understand, based on yesterday's data, 61% of the population have been fully vaccinated and 71% taken the first dose. But a disclaimer here, as I said, this information is based on my Sejahtera has said yesterday. I'm sure Dato Dr. Anas may have more updated status, so we will hear from him later. The public-private partnerships have indeed significantly contributed to the success of PIC. Those of us who are in the corporate sector will know how important the PICAS program was to the corporates to ensure the successful rollout. ProtectHealth Corporation is the organization appointed by the Ministry of Health Malaysia to lead the public-private partnerships to increase the involvement of the private sector in the National Immunisation Programme. Hence, we are so delighted to have with us this afternoon the CEO of ProtectHealth, Dato Dr. Anas, to share his insights, discuss the role and distribution of private sector in PIC, as well as we look forward for Dr. Anas to share his experience in managing such a momentous task or responsibility. So, Dato, we really appreciate you taking time off your busy schedule. I'm sure it still is a very busy time to be with us today and share this insight. But before we start the session, I've been asked by my colleagues to do a bit of housekeeping rules first for the webinar. So in terms of the question and answer session, we encourage all our participants to ask questions. We want to make sure it's a bit of interactive session. So if you like to ask a question, please type your questions in the Q&A tab, which you'll see on your screen, and not the chat box. And our moderator will attempt to address your question as much as possible. So now moving on, before I pass the session to David, our moderator for this afternoon, please allow me to do a quick introduction about David. David Ng is currently the Managing Director of International SOS of Malaysia and Myanmar, and at Malaysia itself, he oversees all of the international SOS operations in Malaysia, encompassing over 450 employees. International SOS, for everyone's information, is the world's leading health and security assistance company, operating over 1,000 locations in 90 countries. The company is headquartered in London. We are so proud that International SOS is an esteemed corporate sterling member of BMCC. And I'm also very proud to say that David himself is personally an active and a strong supporter of a chamber, having served on the BMCC board for nearly 10 years. Thank you, David. So David, over to you to start the conversation with Dato Dr. Anas.
Thank you, Jennifer, for the introduction. Good morning, all. We are indeed very privileged to have Dato Dr. Anas with us today, who keeps to a very busy schedule. Welcome, Dato. But please let me start by giving a brief introduction of our distinguished guest. Dato Dr. Anas was appointed as the CEO of ProtectHealth Corporation effective October 2020. And prior to that, he has over 20 years of experience in the hospital support services and the oil and gas industry. He was the former secretary for the Malaysian Oil and Gas Services Council and the treasurer of the Malaysian Asset and Project Management Association. He is an author of the bestseller, Rich Malaysia, Poor Malaysians, in an attempt to provide insightful policy ideas for the nation, ensuring that Malaysia gives the best for its future generations. He has strong research experience in setting up successful think tank and NGO for volunteerism as part of social contribution to the nation. He was recently named 100 most inspirational LinkedIn icons in Malaysia and was named Malaysia's Inspiring People by the Malaysian Insider and top 10 social media influencers by Astro Awani. He lives on only one hope: for future generations to inherit a better Malaysia. A very impressive background, Dato. So the floor is yours to provide your opening remark.
Thank you, Mr. David, for this, for the kind and generous introduction, and also to Ms. Jennifer, and also the British Malaysian Chamber of Commerce for hosting this. While it is interesting to be part of the program Imunisasi COVID Kebangsaan, perhaps I would, before we introduce our journey, we will give some background on ProtectHealth Corporation Sdn Bhd for a start. ProtectHealth Corporation was incorporated in December 2016 as a wholly owned subsidiary of ProtectHealth Malaysia, established under the Ministry of Health. It is a not-for-profit company, and we coordinate, administer, and manage initiatives related to financing healthcare services as mandated by the Ministry of Health. When we were established, we were given by two big mandates. These two mandates, as approved by Jemaah Menteri, is to do voluntary health insurance for all, and also to become the strategic purchaser to reduce healthcare costs and enhance primary healthcare. At the moment, the focus is on becoming a strategic purchaser. And in 2019, as per the strategic purchaser mandate, we carry out our role as the healthcare scheme administrator for Scheme Peduli Kesihatan untuk Kumpulan B40 as mandated by the government. And last year, we were appointed as the ESP operator for Scheme Pelindungan Insurans Kesihatan Pekerja Asing. So these two initiatives are part of a strategic purchasing effort. And with this experience and capabilities, on the 8th of March, ProtectHealth has been appointed by the Ministry of Health as the implementer of Private Medical Practitioners and Healthcare NGOs participation in the National COVID-19 Immunisation Programme. Of course, when we started, there is no playbook. So it had been a wonderful, long journey. To give some background, Malaysia's health system, as you can see, there are spheres of components under the public sector and also the private sector. ProtectHealth is to bridge these components so that we can utilize and maximize the best in public and also private in delivering our healthcare system. As you can see, in Malaysia, there is lack of integration, and the current healthcare system seems to be dichotomous model where there is unequal distribution of resources between public and private healthcare. And we want to bridge this gap to ensure we can get the best out of public and also private sector. And a statement made by Tan Sri DG in 2019 stating that MOH is currently underfunded, understaffed, underpaid, overworked, overstretched with overcrowded patients. And there's a statistic showing that 40% patient waited 6 hours at emergency department. With all this underfunding, underfunded, and strained resource requirement at MOH, Suddenly in 2020, early 2020 or late 2019, COVID-19 pandemic kicks in worldwide. With the current stretch of resources at government facilities is a worrying situation. MOH, with their day-to-day routine works, their day-to-day care, suddenly have to admit and manage COVID cases. ICU beds are getting full in, and that was in 2020. And coming into 2021, MOH realized that it's the time that more participation from the private medical participation must be brought in. As is, before COVID, the resources is already fully used. Now with COVID, some of the works, what we call kerja-kerja hakiki, is being put aside to manage COVID cases. As such, for the vaccination program, there's a strong push to bring in the private medical participation into the program imunisasi COVID kebangsaan. So we were brought in March. As I said before, there was no playbook, there was no rule, and we were appointed as the implementer for the participation of private medical practitioner. So given with our experience in PKB40, we work closely with MOH to come up with guideline, manual, come up with onboarding system for the private facilities, coming up with models, how we want to manage and implement private participation. One of our role is to develop a proprietary system, vaccine control system, which will link up all our private medical practitioners in order for us to register them, to manage our provider, to do onboarding of all the facilities of all the pusat pemberian vaksin, to do training, material and many other functions. As the VCS also link up to MyVas, which is the provider module for MySejahtera. And we also perform payment to the PMP and NGOs. We monitor vaccination activities. We have a dedicated help desk and call center line for all our providers. We register them through this system that we've developed in-house. And we also provide continuous training and manual to all our providers to ensure that they give quality vaccination, they follow regulation and all the guidelines as developed together with MOH. We also carry out relevant analysis and reporting for all our pusat pemberian vaccine, and also support the development and operations of all the pusat pemberian vaccine in the country nationwide. So just to give the whole picture, it's easiest to present through milestone. As I said earlier, we started on the 8th of March. We were appointed as implementer of private medical practitioner. So we were appointed to do vaccination for phase 2, which at that time was slotted to kick in towards end of April, early May. And at that point of time, MOH has started vaccination for the first phase, phase 1, for the frontliners. And as you can see on the slide there, at this point of time, we have 0 PPVs. We have not done any dose of vaccination. And MOH have done 197,000 doses of vaccination. And at this time, we were busy mapping out how we want to roll out the private medical practitioner and calling all the private medical practitioner on board. We had launched our website, we launched our registration website, and we go to the media and inviting all the private medical practitioner to join the program. And on the 12th of April, we announced the participation of private hospitals. We realized that we cannot only utilize the general practitioners. We would want to include all the private medical practitioners, and that means also the private hospitals. And as you can see, on the 12th of April, the country nationwide have done 1 million doses of vaccination. To include the private hospital also, we had to ask the minister to come up with arahan so that we allow private medical practitioners from hospital to perform medical services outside facilities. So we had that arahan to come out, and we move further. There is also the clinic pakar and also the ambulatory care center, which we believe should be included in the program. And as such, now we have 4 categories that can join the program imunisasi COVID kebangsaan. And on the 30th of April, we started with pilot GPs, general practitioners, giving vaccine, and we have 3 PPVs. And at this point of time, nationwide, the vaccination doses is at 1.4 million doses. And on the 3rd of May, we started with our first PPV offsite together with the private medical practitioner at WTC KL. If you remember the AstraZeneca registration, the AstraZeneca vibe at that point of time, and then at UKM and also at UM, and also in Johor, later in Penang, Kuching, and Miri subsequently. And at this point of time, we started, as you can see at the slide, we've already contributed 5% to the vaccination program, and with 20 PPVs. And on the 4th of May, we started our vaccination using the general practitioners nationwide. And in June, the government came out with a program to encourage, the government allows critical economic sector employers to vaccinate their critical economic sector employees. This is a program that worked closely and started with MITI, which subsequently rolled off to all the other ministries. There was PICAS, there was IVAC, there are many programs under all ministries to vaccinate critical economic workers. And the different thing is, under this program, the government provide the vaccine, but all the vaccine administration is borne by the employer. And as you can see, in June, mid-June, we've started. We're trying to push all the private facilities out. And at this point of time, we already have 438 PPVs giving vaccination, and ProtectHealth contribution to the total vaccination doses is at 17%. On the 16th of June, MOH and CITF extended our scope to also include the NGOs, healthcare-related NGOs. And at that point of time also, the target population, which was initially 30% for ProtectHealth to cover, was increased to 60%. And we realized that in June, they are going to, more vaccines are coming in July, August. So we had to push all our capacity to ensure that all the vaccine that come to Malaysia is fully utilized. No vaccine inside the storage. All vaccine must be put into the arms of the people. And also in June, we have started, while we are doing all these mega vaccination sites, while we are doing PPV on site with the GP hospitals, we are also starting to go for the other more difficult people to come to the PPVs. So we started with PPV OKU, and we've started mapping out how to do mopping up and outreach to ensure that every Malaysians or every Malaysian residents are vaccinated. And at this point of time, as you can see, our shares of vaccination is at 18%. And 21st of June, the share grows to 20%, and we've contributed to 1 million doses. And in July, our healthcare NGOs and our private medical practitioners start carrying outreach. The PPV megas are continuously giving vaccination. And mid-August, you can see the number grew. At that point of time, ProtectHealth's contribution to the National COVID-19 Immunisation Programme is 44% of total vaccination dose. and our PPVs at that point of time is 2,088. And on the 25th of September, as of today, close to today, we've vaccinated 20, and today's number is 20,500,000 doses, which is 48% of nationwide doses, which is at 42 million doses vaccination. And until today, we've opened more than 2,300 pusat pemberian vaksin utilizing private medical practitioners. So the first 2 months is getting all the private medical practitioners on board, finalizing all the guidelines, training, setting up how we want to do this, how to roll out, because it takes a lot of project management efforts. It takes a lot of detailed coordination. Operational level is massive. At ProtectHealth, we had to utilize everyone. We had to even have additional manpower to bring on board, because it is a tough journey. There was no playbook, and every day there is something new or something, some issues that we have to resolve. And this takes planning and at the same time problem solving skills and method. And we have twice or three times CITF meeting to coordinate and getting feedback from everyone and getting direction from the ministry of all the issues that we face, and decisions are made on the go, which is we are lucky to have swift and fast decisions for us to implement the program. And it has been a long journey, and we can say that it has been a successful one. By having the private medical practitioner to come on board, we did a lot in July, August, and September. And by that, we ensured that all vaccines that came is fully utilized. Even though having some setback in May and June, where some of the vaccines arrival is delayed, but once the vaccine reach in Malaysia, no vaccine is being left at the storage, but being put on people's arm for vaccination. And you can see how Malaysia now is doing since February to September. We reached a high of 533,000 doses per day, and ProtectHealth reached a high of 350,000 doses a day in July, August. And as you can see, back in July, we have been vaccinating rapidly and has passed several other countries. And today, as we can see, we are at top 30 countries in the world in terms of fully vaccinated number. And if we take just fully adult vaccinated, we are at a higher number. This is, as you can see, the monthly doses administered. You can see in February, March, April, May, June, ProtectHealth's contribution is minimal because we plan to start for phase 2. And knowing and understanding that vaccine is coming in June, July, August, we managed to meet the gap and ensure that the capacity is there and all the vaccines are fully utilized. And you can see in Klang Valley, under the operation surge capacity, the private medical practitioners' contribution is massive. As you can see there, 4.5 million doses in July. As of today, this is the number today, as of yesterday. Total doses done, 43 million doses, and 47% is contributed by the private medical practitioners and the NGO. And the reason the vaccination is successful is because everybody was brought on board. We did it together, both public and private. It's a good partnership. And once the private partners in July, August, September took a lot of the share from MOH are able to fight all those COVID cases in July and August, and also in September. This is to share the number of facilities of pusat pemberian vaksin nationwide. You can see in Perlis, Kedah, Pulau Pinang, the number of the red box is for on-site facilities. The general practitioners, the hospital swasta, private hospital, the clinic pakar, and also the ambulatory care center. So nationwide, there's 1,900 facilities. I would imagine half of the population would have either gone there, or the integrasi, or the industry, or the outreach, or at the KKM facilities. And the blue box there is the PPV integrasi. PPV integrasi is those public PPVs off-site, such as WTC Kuala Lumpur. In Johor, you have Iskandar Studio. In Kedah, there's PPV Aman Jaya. So those are what we call PPV integrasi. PPV industry is the one I mentioned earlier with the ministries. And PPV outreach is where we go to the people, we go interior, we go rural and do vaccination, and also we do bedridden and home vaccination program. This is the number of doses, total doses under ProtectHealth as of 21st September. You can see high number in Kuala Lumpur. 89% of total doses in Kuala Lumpur is contributed from ProtectHealth. Selangor 73%, Penang, Johor 60%, and others. Under the PPV industry, a total of close to 200 pusat pemberian vaksin nationwide was opened, and these are programs under MITI, which is called PICAS, KPDNHEP, REVAC, MOW, CVAC, MAFI call it IVAC, and there are various PPV industry programs in Sarawak, and also with MOT and MPIC. So as of 21st September, 2.4 million doses is from PPV industry. Moving forward, next, we still have to do mopping up and outreach. Mopping up is a general term for vaccination when you do what you call that, golongan tercicir. We've done the majority of the vaccination at mass PPV vaccination sites, and now we have to continue mopping up and continuing doing outreach to ensure that all the population is fully vaccinated. We started bedridden, giving home-to-home vaccination in July, using getting help from the healthcare NGOs, the Malaysian Red Crescent, National Cancer Society, IMARET, and also Mercy Malaysia. They started in July, and we gone to the rural areas, started in August, Orang Asli, and also detention center, and also the migrants. And we have to ensure, in order to ensure all the population is vaccinated, all this target population is, we need to ensure they are also vaccinated. Thanks. So I would imagine this is all from me for now, and I hope the audience can appreciate and understand how and why it is important to bring the private sector on board to assist in the vaccination program. And with their contribution, we managed to go through the critical period of July, August, and September, and boost up our vaccination to a high 550,000 doses a day vaccination. And with that, over to you, Mr. David. Thank you.
Thank you, Dato, for sharing your thoughts and experience in the past 1 year. We will now move to the Q&A segment. To the audience, once again, if you have any questions, please feel free to key them in the Q&A box, and we will try to answer as many of them as possible. Thanks again, Dato, for a very interesting presentation. There's a lot of facts actually I was not aware of. For example, that ProtectHealth contributed to 47% of doses in Malaysia, and during this short period of time. It is really impressive, and that top 30 countries, Malaysia is in the top 30 countries for fully vaccinated population, and for the adult is even higher. So all in all, a very impressive milestones that you have shared with us, Dato. So my first question is, I think the rural area. I think you mentioned that the rural area is one of the target population. How has the partnership with the private sector contributed when it comes to the vaccination rollout for the rural area? If you could share your thoughts on that, Anas. Dato.
Thank you. Actually, so when we launched the program in March, we brought all the private medical practitioners to register with us. To date, we have 3,000 private medical practitioners registered with us. And over the period of time, we've undergone, we learn new things, Mr. David. We understand how to do planning better and we are able to see each PMPs or each private medical practitioner's strength and weaknesses. And when we go to the rural areas, it is about working together with multiple government agencies. Example, with Orang Asli, with JAKOA, with the rural areas, with KPKT, Kementerian, and other ministries. And also when we want to work for the bedridden, we spoke with JKM and JAKIM and all. So the private sector, when it comes to the vaccination in rural areas, together with the healthcare NGOs, has been doing quite a lot in the rural areas. It's in starting July and August, Mr. David.
Right. Okay. I will go to the Q&A box now. I have a question for you from Mr. Jeffrey. The question is, what are ProtectHealth initiatives that you can share, especially towards raising awareness on getting people vaccinated?
So our effort in getting awareness is mainly a concerted effort, because the communications will all be from the COVID Immunisation Task Force and the Ministry of Health. So we assist by monitoring vaccination sentiments at the ground through our PPVs. Our private medical practitioners will give feedback and will give, and also our team is monitoring the social media. And through all this frequent engagement, constant communication together with Ministry of Health and COVID Immunisation Task Force, we contributed and shared all these feedbacks to them and raised all our concerns at the frequent task force meetings.
Dato, on that, there are a lot of countries where there are a lot of anti-vaccines people who are reluctant to take vaccines. Do you see that as a problem in Malaysia?
As you can see, Mr. David, from the number, when we started the vaccination program, I'll give an example, AstraZeneca. So public sentiment was very negative, and at that point of time, the task force was unsure to include AstraZeneca in the rollout in the main program or to do a separate vaccination program because the sentiment was negative. That's why the AstraZeneca was pulled out from the mainstream vaccination, and we had 3 PPVs, and the registration was first come first serve. But surprisingly, everybody was rushing and tried to get their AstraZeneca doses. So it's, and based on the study at that point of time, when we analyzed, the anti-vaccine population is not that many actually, but it's loud. What I'm trying to explain is the quantity is small, but the volume of noise is big. And as evident by the number of people that we've vaccinated to date, I mean, for the adult population, first dose, we've vaccinated 94% first dose. So I would imagine the population is very little as more people are being convinced by the data. I think most importantly is the data, and MOH has been very transparent. And with COVID now, everyone can monitor the numbers. Everybody see how many number of hospitalization and ICU. And as you can see from the trend, it is going down. And vaccination has been proven to be successful. And this all boils down to individual at the end of the day, Mr. David. And Malaysians, when they see that based on the data that vaccine works, it saves lives, more people are becoming more convinced. We know that for a fact because we noticed surge of registration. When we started vaccination, the number of registration is, I can't remember now offhand, but it was much lower than today. And in August, we can see people are rushing to register. So we can see the sentiment has changed when there's a global movement pushing for vaccination, taking vaccine, and locally in Malaysia too, we can see how the number swing and more people are getting vaccination. And I think looking back on a hindsight, there have been many policy decisions made at that point of time with limited information at those times that the committee have made fantastic choices.
Right. I have a question, Dato, from a concerned parent from Go Sorting. He understands that the vaccination program for teenagers ranging from 12 to 17 of age has started. And as a concerned parent, Go would like to know if there are sufficient data proven that the vaccine is safe for teenagers below 18.
Okay. At the moment of the data and the vaccine type approved is for Pfizer for the age of 12 to 17 for adolescent vaccination. And just as is when we started vaccination the adult, we go through clinical data, and as soon as the NPRA approve the use of the vaccine and consider it safe, then only we are allowed to use the vaccine. And as you can see, yesterday there was an uproar at the social media where this one lady without her mask on telling lies about AEFI cases, claiming that a certain individual died from vaccination, and investigation find out that it's purely fabricated lies. And based on data worldwide, adolescent vaccination has been proven safe, and Malaysia has approved the use for Pfizer at the moment.
Yeah. Okay. I have another question from Dr. Edwin Ho from Shell. Thank you, Dr. Anas, for a job well done on all the achievements with Protect Health. Dr. Edwin is asking, considering that many countries manage COVID-19 vaccination via their own government, could you help us understand the reason why the private arm is required to manage the vaccination instead of MOH themselves? Dato?
Why a private arm is required to manage?
Yeah.
So the question Dr. Edwin is asking is why ProtectHealth is rolling out the private medical practitioners, or why we need the private medical practitioners?
Why we need the private medical practitioner, Dato?
Yeah, I understand why. If why we need private medical practitioners, I think is what the presentation was about just now, where we want to bring in the private medical practitioners. We want to bring in the GPs, the private hospitals on board together. Because we believe the vaccination can only be successful by getting everyone on board. And particularly the demographic and geographical also is spread out better when we bring all the facilities on board, and when we have more facilities on board, we are able to distribute our population to the PPV sites better.
Yeah. So I think the rapid rollout, Dato, that we have seen, could only happen with the public-private partnership, right? In such a short space of time.
And Mr. David, we are lucky that we started this back in March in getting everyone to come on board, doing all the trainings and etc. Imagine if we started this in July when the ICUs are full, when all the hospitals beds are full, when the government health care system is at the brink of collapse. If we decided at that point of time to bring in the private medical practitioners to do the vaccination, we would not have been able to do it at such a space of time. I think that the fact that bringing private medical practitioners on board early, some would say it's also very late. Some would say to have brought it last year, because my call to arm message has always been to the private sector. When we started the program, I've always been telling all the private medical practitioners, look, the government has been struggling for a year. They have been sweating blood, tears the past 2020, in the year 2020 and early 2021. So now is the time for the private sector to come in and do your share of the work. So that has also been the rally cry in early this year.
Yeah. As you say, Dato, that there was no playbook before, and every day there are new issues cropping up which needs to be solved. So probably a lot of problems needs to be solved on a daily basis. As a leader of an organization responsible for such a momentous task, what were the most challenging situations, and what was your strategy to overcome them?
I would imagine one of the challenge is that every different pusat pemberian vaksin, despite having a general challenge, but every location would have its own localized issues where we have to, there are many ways to skin the cat, but we have to find a way that we wanted to try to one size fit all when implementing the pusat pemberian vaksin. For an example, the 5 stations, when you go to a PPV sites, you have 5 stations. You have to scan, you have to do many things. So standardizing all that across the country, we could have done it differently. Maybe station 3 is in front, station 2 at the back. This all seems rudimentary, very simple, but fixing that up front proves effective in the long run. You've been to ISKL
Yeah.
yesterday.
Yes.
So the flow that you saw is finalized early this year, and that has been the flow everywhere. There is modification here and there everywhere, but getting it right in the beginning is very important in implementing and rolling out the PIC program.
Yeah. I think the 5 stations, Dato, is very efficient. Yeah, it is simple but very efficient, and you can see that in a day, 1 PPV you can do 2,000-3,000 vaccination seamlessly. So it's proven to work very, very well, and very, very impressive. Yeah, the layout. I have a question from Wendy Chan from International SOS. She said that excellent contribution from public health, especially towards the NRP. But what's the roadmap for the PPVs and public Protect Health's involvement for the booster shots?
Yes. Okay. So what's the roadmap for the PPVs? Okay.
Yeah.
So the mega PPVs will slowly be phased out. We needed the mega PPVs because at that point of time we wanted to do mass vaccination. We wanted to vaccinate as many people as possible. Imagine in Selangor Klang Valley, if you recall, Mr. David, we did I can't remember exactly 6 million doses of vaccination in a month or something like that. So all these big numbers can only be done at mass vaccination sites. It's more efficient. We can concentrate the manpower at that site, and we can coordinate better. Of course, all PPV types has its roles to play. The clinic, private has its roles to play. The government hospital have a role to play, especially managing the AAFI, prone to AAFI cases, the special PPVs, and the mega sites, and also the PPV industry where we wanted to address the foreign workers, the migrants, and then we do home-to-home vaccination for those unable to go to the vaccination sites, etc. But moving forward, having mega sites is not sustainable for the long run. We cannot be having mega sites for the next 5 years. So it has to be phased out naturally. So moving forward for the booster shots, third dose, and adolescent vaccination, the private sector will still play a pivotal role in implementation. That is something that we are working closely together with the Ministry of Health in order and how to finalize and facilitate the rollout.
Okay. And another question, Dato, from Vinesh Babu. Do you mind to share Protect Health's plan in the rollout of the booster vaccination shots? What is the timeline are we looking at? And I hope we don't have to register again for the appointment, but will be done automatically. What are your thoughts on the booster shots, Dato?
As announced by the Ministry of Health, there's dose ketiga, third dose, and also booster shot. Third dose is for the high-risk group, the frontliners, meaning they will be given another dose in the near future, which could be as early as October, which is that's tomorrow. I would imagine certain location would start next month, for the third dose. For the booster dose is for those that the government feels that the duration has been a while, and potentially the the efficacy might have gone down a bit. So that's the booster dose. So, so the question is on the timeline, right?
Yeah,
So,
the timeline.
so other governments have done it in between 6 to 8 months. So I suppose it will be a policy decision by the government. But I would imagine it will be along the similar duration. But I cannot say for sure. But I would imagine it will be a similar duration, 6 to 8 months. And in terms of the how it will be set up, I would personally envisage a booking system, an appointment system, where I can open up my Sejahtera, and let's say I'm staying in Cyberjaya, and then I can choose which clinic to go and when can I go for my booster dose, something like that. And
Right,
there's
right.
you have to take your booster dose in March or April, and I will
Right.
have ability to choose a date. It is something that we would envisage to be an ideal world, I suppose.
Right, right.
This is what we did now, because when we roll out the program imunisasi COVID kebangsaan, there's a rush to ensure everyone get vaccinated. But what we are doing for the booster dose, the third dose, is a supplemental, is an additional protection. So I would believe if we can plan it through a booking system, but this has to be a policy decision. But
Yeah, yeah.
my thoughts on the question. It would the best would be through a booking system. So Mr. David, you can open up your phone and
Yeah,
find the nearest facility to get your shot,
yeah,
and
yeah,
when you are flexible to
yeah,
go
yeah,
shot.
yeah,
And the facility that is going to arrange the shots
yeah,
would have to come back to you and say, Mr. David, look, if you come today, we don't have enough people, so some
yeah,
of the vaccine, would you consider coming tomorrow?
yeah, yeah,
Something like that along
yeah,
I
yeah,
think.
yeah. I
I
guess the
would,
government will come up with a policy on the booster shot, right, in the future. Yeah.
how the
Okay.
operational will be like,
Yeah,
but
that's right.
I would support a booking system method.
Yeah, yeah. All right.
We have to give more thoughts to it, because on the booster dose, Mr. David, more consideration we have to consider. The government purchased a lot of Pfizer, if I'm not mistaken, 44 million doses. Then Pfizer, because our skin color, Pfizer send more to the Western countries. Our
Yeah,
delivery delayed and delayed and delayed. Sinovac in June, July save us because we have a lot of Sinovac we can use.
right.
So when we go booster dose, a lot of discussion. Okay, and are we doing it homologous? Are we doing it heterologous? Are we going to use the same vaccine type? And it will affect government supply of vaccine. How much more do we have to buy more? How much we retain? Are we able to fully utilize these Pfizers that we have purchased? So all these are interesting conversation that policymakers will be finalizing. And then there's another discussion of, would we allow people to choose their third dose? Will we make
Right.
it? Will we
Right.
choose it for them? So these are policy questions that we would appreciate the consideration, but we also understand the difficulty in coming out with these policies, considering the supply, and we have to always go back to the technical people on the
Yeah.
health aspect of it, whether it works, whether it doesn't work, and what is the best way to do it.
Okay. So I think we have time for one last question, Dato. And this question is from Rufiza Razali. What is the role of ProtectHealth in the vaccination of teenagers? I know we have started vaccinating adolescent this week. So what is the role of ProtectHealth?
So again, it's actually similar role. The ProtectHealth is also involved. We are also bringing the private medical practitioners and also the healthcare NGOs on board, involved in the adolescent vaccination. And Mr. David, when you go to ISKL, you were vaccinated by a private medical
Yes,
healthcare provider.
that's right.
As of today, we've contributed to 30% of total adolescent vaccination, and
Wow. Yeah.
I think the number will go up as we roll out more PPV outreach to schools, and
Yes.
as we bring on the PPV facilities on site for vaccination at premises.
Yeah. I think that's all we have time for, Dato. And I want to thank you so much for taking time off from your busy schedule to be with us today. We have learned a lot today about the vaccination rollout in Malaysia for the past 1 year. And I think I can speak on behalf of a lot of people out there who are immensely grateful to you and your team for doing such an excellent job in helping the nation achieve herd immunity. So thank you very much, Dato.
Thank you, Mr. David. Thank you for BMCC for having us. And I would like to take the opportunity to thank all Malaysians for coming on board to receive vaccination. I think that's the most important thing. We will not be able to do this if we didn't get the support of the population to come to the PPV sites, to come to the centers, come to the clinics to get their vaccination. And we would like to thank all Malaysians for doing their responsibility in making sure they are safe, and also at the same time making sure their families are safe by taking the vaccination. Yeah.
Thank you, Dato. And I now hand over to Jennifer.
Thank you, David. Thank you, Dato and David, again for the interesting and informative. Definitely, really some new insights that we got to hear, and we are very lucky to have Dato to share first-hand information. So that brings us to the end of our webinar for this afternoon. We'd like to thank Dato and David again for joining us today. It has, broadened, I'm sure my audience will understand, it's broadened our understanding of the importance of private-public partnerships in PIC, which definitely helps to make the National Recovery Plan a success. So with Dato, we wish you and your team continued success in the rollout of the program as we all aim towards herd immunity, and importantly, to keep all Malaysians safe, Dato. So all the best to you and wish you well. Before we leave the session, I would like to share about BMCC's upcoming event together. Something on climate action. I know Dato is very passionate about this. So upcoming event, together with the British High Commission Kuala Lumpur, we will be organizing Malaysia Climate Action Week from the 25th to 29th of October. And this will be a 5-day impactful webinars on various themes and focusing on climate action taken by different sectors. So we hope you all will join us soon. So look out for more information on it, and please join us then. Register now. So with that, thank you so much again, everyone. Thank you for joining us. Keep safe and take care. Bye for now.